session. And please pay close attention during the visiting professor. And question can be asked by chat menus. Do not forget to subscribe YouTube channel at Kesmas UNES. We also streaming this session in YouTube channel of Kesmas UNES. And in the end of guest lecture, it will be informed the URL of the e-certificate issuance, so do not leave the Zoom. And the link is active for only 60 minutes after this guest lecture. Okay. Please wait a moment, Professor. I will check for all the participants. Okay. Professor Mahalul Azam, can you hear me?
Yes, Budina. Yes, Budina.
Okay.
Assalamualaikum. Thank you, Budina, for arrange this class, online class. Thank you, Prof. Shabbir. Nice to meet you again here.
Yeah, likewise.
Okay, it's already around 175 students join us. Okay. Can we start, Prof?
Yes,
Sabir?
I'm fine.
Okay. Okay. Assalamualaikum warahmatullahi wabarakatuh. And afternoon in Semarang and Taipei to our honorable guest, Professor Shabbir Sheikh Abdul, and all of my colleagues and students at Faculty of Medicine, Universitas Negeri Semarang. Welcome to visiting professor session. My name is Dina. It's my pleasure to be a moderator for this session. And I'm glad to welcome Professor Shabbir Sheikh Abdul from Taipei Medical University, who will present new development in artificial intelligence of things wearable devices for telemedicine and home care. First of all, please welcome Professor Dr. Mahalul Azam, Dean Faculty of Medicine, Universitas Negeri Semarang, who will give welcoming speech. The screen is yours.
Thank you, Bu Dina. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Our colleagues, Professor Shabbir Sheikh Abdul, medical doctor, PhD from Taipei Medical University. Thank you once again for accepting our request to become a visiting professor today. And yes, thank you for many time you accepting our request to academic collaboration in Universitas Negeri Semarang. Thank you, Prof. Shabbir. And our colleague in faculty members in Faculty of Medicine, also in Faculty of Technique, we have faculty members and students also in Fakultas Teknik, especially that concern in the digital medicine. And yeah, especially Budina, thank you for arrange this visiting professor today. So the very interesting topic, new development in EIoT, artificial intelligence of things, wearable device for telemedicine and home care. I think this very interesting topic will make our insight in the not just Internet of Things, but artificial intelligence of things that very useful to support the telemedicine and also in home care activities. Thank you very much for the very interesting topic today. And we have here a student in public health, undergraduate, master degree, and also in a doctoral degree, Prof. Shabbir. And also we have a student in the Department of Nutrition, as well as in the Department of Pharmacy, and also the Department of Medicine. We have six study program in Faculty of Medicine, and like I said before, that also participated by the student and faculty members in Faculty of Technique, especially in the study program of digital medicine, yeah, concern in their digital medicine. Yeah, I think I also hope that our deep collaboration in academic collaboration can be increased. We know that we also conduct the research collaboration as well as the joint publication, and I hope we have here the student in master degree and postgraduate degree that may be concerned in the area of digital medicine. I hope Prof. Shabbir also accept our request to become maybe
Definitely.
joint supervisor with our student to make our student and our international collaboration, especially with Prof. Shabbir in Taipei Medical University. Yeah, I think thank you once again for your accepting our request, and we hope all of participants here, the student, the faculty members, can get the benefit, the fruitful benefit from this visiting professor session today. Thank you once again, Prof. Shabbir, and for all of audience, all of participants enjoying the visiting professor. And yeah, thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Professor Mahalul Azam, for the warm welcoming speech. Before the presentation begin, allow us to introduce our guest lecturer. Professor Shabbir Syed Abdul graduated with a PhD degree in health informatics from National Yang Ming University, and he is a full-time professor at Graduate Institute of Biomedical Informatics, College of Medical Science and Technology, Taipei Medical University, Taiwan. Professor Shabbir also got many scholarships, publication research awards, and patents, and he has more than 100 research publications and guest editor of prestigious journal. His research interest is artificial intelligence, digital health, social networking in healthcare, and health aging technologies. And now, please welcome our special guest, Professor Shabbir Syed Abdul. The time and screen is yours.
Thank you so much, Dina. Bismillahirrahmanirrahim. Assalamualaikum. Rahmatullahi wabarakatuh. So definitely I am pleased. It's my pleasure to share my experiences with you all. So I will share my screen, please.
Okay.
Yeah, you need to.
Okay. Stop.
Yes. Yes. Please let me know if you can see the screen.
Yes, we can.
Good. Thank you. So first of all, once again, thank you for inviting me and having me as a guest lecturer in your university. I thank our Dr. Mahalul Azam and yourself for making this collaboration. And as I told, with my heart, I am very much open to make more collaboration, to make like more publication as well as supervision of PhD and master thesis in your university. All good for me because definitely that's the main purpose of any professor to disseminate the knowledge, right? That's our basic tool. Wonderful. Now coming back to the topic, yes, as Dr. Mahmoud Adam told, this is in fact very needful topic, that is use of wearable device in telemedicine and home care, because as we know after COVID things have been changed, so we are know the power of IT and digital technologies. So let's go ahead because yeah. So before going to our problems, I would want to highlight the before going with the solutions, I would like to highlight the problems. Therefore, we need changing healthcare needs. We need to know what are the healthcare needs, how they are changing, and how we can support this type of needs using solutions. So, number one, we agree life has been changed previous COVID and after COVID. Now everything is digital. You say marketing, you go for education, you go for what you say shopping, all those things. Everything has become online, and what you say health is not an exception, because this mode of delivering lecture itself is so much, although we had pre-COVID, but after COVID it has become more prevalent, and everyone is so easy to arrange some sort of lectures from the professors from abroad, like we are doing right now. This is e-education or online education, what we say. In the same way, we can do for telecare, providing healthcare. So therefore, these are five points or five problems which I have highlighted. Number one, reduction of unnecessary visits to the hospital. That we have to do. Otherwise, we cannot cope with the increasing number of patients to our hospitals. That too unnecessary visits, right? Next comes remote monitoring and interpreting of the data which we collect from the patients. So if we don't want them to come to hospital, then what we want to do? We want to monitor them at their home. So we are taking healthcare beyond premises of the hospital, beyond premises of our primary care centers. We don't want even people to come to primary care. We can see them in their home. How? I will tell in coming slides how we can monitor and what we can do. At the same time, we need long-term care for chronic disease management. Of course, we don't want to miss patients. We don't want them to develop complications, because long-term care of chronic disease means these people already have some issue. Maybe hypertension, maybe diabetes, maybe cancer, maybe kidney problem, where they need very long care of long-term care, maybe for the rest of their year life. So therefore, we need to see once they have disease, the next thing what we can do is that stopping the complications. So if they have hypertension, we should see they don't develop MI. We should see they don't develop other complications because of hypertension. It can be renal failure, it can be eye problems, like that. Same thing applies for diabetic patients. If they have already diabetes, then very easily they can develop diabetic retinopathy, they can develop diabetic renopathy, diabetic nephrology. So there are so many complications that can happen if we don't maintain and manage the disease properly. Then teleconsultation of patients at home. Even if we need their patients to monitor and to discuss, then you can arrange teleconsultation from the home of the patient. The patient don't need to come all the way traveling 1 hour and waiting for another hour for the doctor, and the doctor see and see, okay, continue same treatment. Or just see and say, okay, you are fine, just to maintain what you are doing. So just to listen this, why they need to travel so long, they should spend so much money. So all this can be changed. And the most important thing, the doctor can use the time for people, for the patients who really needs them. The doctor, the nurse can give more time to the people, to the patients who really need this type of what you say, consultation, real consultation, face-to-face consultation with the care providers. And the most important thing is ensuring continuity of care. As I told, we cannot just monitor them or observe them when they come to hospital. We need to have continuity of the care. Continuously, we need to see so that they don't develop complications. They don't get, even if the patients with the cancers, they need continuity of care so that they don't get relapses, they don't get complications of what they are doing. Right? So just give one more look to all these problems, because these are very important problems. If we don't think these are not important, then there is no point of discussing the solution. Therefore, all our solutions should be focusing on these problems. Then comes solutions. Remember, technology is not a solution. Technology can be only one aspect of the solution. So we need to give importance to the problem. Whether what technology will provide solution, we need to choose that. So here I am talking about artificial intelligence of things. So before going there, I would really emphasize, or I want to recall what is artificial intelligence, number one. Then I can go with Internet of Things. Then I will go with combining artificial intelligence and Internet of Things. Number one, artificial intelligence is nothing but making machine to think like human, and the output will be making a decision. That is intelligence. Because there is something called natural intelligence in our brains, human intelligence. What is human intelligence? The ability to make a decision, right? If there are two students, A and B, and we give an exam, A answer everything, that is like he make perfect decisions to answer. The second one, student don't know how to answer, so he don't answer. So we assume the one who answer everything is an intelligent. Why? Because he can recall his memory, he can understand the question, and he will provide the solution. This is natural intelligence. What we are doing with machines is the similar thing. We feed them with all information, and then we teach them what is right, what is wrong. Then the computer can manage to make decision. So example, since I am talking about medicine, I will show you examples. So how about seeing an X-ray, I can find out lung cancer. So as a radiologist, as a doctor, anyone will get training to do that by seeing X-ray of a chest X-ray or CT scan and diagnose lung cancer. Correct? Then what we are doing now is we are giving all these MRI scannings or X-rays to the computer and teaching them, okay, this is lung cancer. Lung cancer looks like that. Annotation. There are like process. We call it image processing. So at the end, we make a algorithm or we make a model by which the computer, by taking X-ray or CT scan, can tell whether there is lung cancer or not. Right? That is called artificial intelligence. Now coming to Internet of Things. What is Internet of Things? Anything connecting to internet makes the Internet of Things. Then what do you mean by anything? Door can be Internet of Things. Your chairs can be Internet of Things. Pen can be Internet of Things. Even a drinking water bottle can be Internet of Things. Anything connected to internet will make them Internet of Things. However, can you please mute your computer?
Any Ekawati, can you mute your microphone?
Okay.
Thank you.
Then now in our context, we are talking about wearable devices. Why? Because we make, for example, this watch is okay, this is Apple Watch, but any watch which is connected with internet is Internet of Things. How? Because this watch collect my heart rate, this watch collect my physical activity. This watch can even do my ECG and transform to my mobile phone. And from mobile phone, it goes to my folder health kit in the server of Apple. This is how it works. But it can be any smartphone, Samsung phone, any phone which is connected to you and collects your heart rate. Can you understand now? Now even our body is becoming Internet of Things. How? Because we can monitor our physiological parameters like heart rate, physical activity, using wearable device and transforming into internet. Then on other side, hospitals, care providers, they don't need to sit and watch always the computer, what is happening with my 500 patients. No, this will be done by the system only when there is abnormality. They gives alert to the caregiver. Caregiver is at home. It can be wife, husband, son, daughter, grandson, whomsoever who take care of the patient or patient himself. Then if we verify, yes, this is some real issue, then we can inform to the nurse. The nurse thinks if it is necessary, it will inform to the doctor. So we can make a model or we can make SOB, standard operating procedure to handle with the data. And other thing is improved human machine interaction. What is this? Once there is artificial intelligence in my watch, what will happen is the watch can make some decisions right within there at that time. How? For example, if I sit for a long time, the watch vibrates and tells me, oh, okay, it's time for you to stand up and stretch and move a little bit. How? Because there is actigraphy, gyroscope in the watch. These are the sensors. And these sensors continuously collect the information of my hand and my heart using heart rate. Obviously, for sitting, they only take my location, position. If I am not moving my hand like I am doing right now, after some time it will say me, oh, okay, get and stretch something. Understand? This is improved human-machine interaction. So it's not like only we can have artificial intelligence in the computers. There is something called edge AI. Edge AI means making a model, putting on a chip and within the sensor. This can make a decision and it can take some actions. Then enhance data management and analytics. Of course, as I told, for one patient, we are getting huge amount of data. That is 24 hours, 60 minutes, and 60 seconds. Each second it is collecting data. Imagine just by the time I am giving this lecture, how much data is collected by my watch, where it is going and what we are doing. That is, we need to do proper data management and analytics. And I'm talking about only one body. Imagine how many bodies are there, like bodies in the sense human beings are there, patients are there, users of the systems are there. So how we are managing that? At the end, We need to have improved clinical decision making after meaningful use of the data collected using this wearable device. Hope all what I am talking now is making sense, because that is exactly what I want to provide for you. So I am seeing some chat. Let me see. If there is questions, you can ask directly. Yeah, okay. If there is what you say, any question, please type it so that I can answer continuously, because I prefer interactive. But since there are like more than 200 students there, so we cannot do interactive. So anyway, I would like to take some questions, and you can stop me anytime by typing it. So then comes the long road of digital technologies, because it is not like our digital health developed in one night or 1 year. No, it took years, decades, like from 90s. I don't know, even in 80s, 70s, we used to have landlines, small black box. Then from there we shift to this phone, Nokia phone. Then in 2000s we got smartphones. This changed so much our lifestyle even. Then we have like computers in our pocket. It can have calendar, it can have radio, it can have audio songs, it can have everything. Then comes the internet within the mobile phones. Again, it has changed a lot in our life. So slowly, we are progressing. But now we are using watch, we are using mobile apps, we are using everything. Then in that way, we are developing our life. So we say like technology designed the society and society designed the technology. Like both goes hands in hand. So now our lives are different. Now news channels, everything we are using on social media, right? So that is how we have changed. We have changed the way we are interacting with the information. Number one, we have changed the way we are disseminating information, right? For everything we are using mobiles and other software, what you say, networking websites, all those things. Then this is the era of connected world. You see, there are hundreds of devices already in the market which can be used, which are connected, and which can, like IoT things. And I want to bring your attention to this particular these two models. One is CGM. It is called continuous glucose monitoring. That means you put a patch on your shoulder and it continuously monitor your blood sugar. Because right now, in order to know your blood sugar, you need to prick, which is like painful. Although it is not painful, it's not good feeling. It pains little bit. So many people don't want to do that. And how many times you can do in a day? One time, two times, two. That's too much. Therefore, this device use microtubules which penetrates inside your skin, and continuously it analyzes your sugar levels. Whenever you bring your mobile phone towards the device like this, it transmits the blood sugar to your system, mobile phone. From there, it goes to the server. If the levels are very high or very low, hyperglycemia or hypoglycemic, then as I told, first it goes to your care provider, then it goes to nurse, then it goes to doctor. In that way, we can monitor the patient continuously. That is one thing. The another thing here are the pill box. Pill box means whenever you open the box send a message to your mobile phone. And there are three different rows: morning, afternoon, night. So you as son, daughter, whatever, you put the all tablets that the patient has to take in the morning box, afternoon pills in the afternoon box, night pills in the night box. So if the patient miss anything to open, because this system assume if you don't open at that time, that means you missed it. Then after like 1 hour, it send a message saying, okay, so far you have been taken your pill after lunch. Then if the patient want, yes, he can go and take. At the same time, the doctor will be knowing or the nurse will be knowing how many times the patient has missed the medication. Right? So this is how we are trying to help, we are trying to monitor, we are trying to make patients compliance or adherence to their medication. Because adherence is a very big problem which we are going to discuss. Okay, now healthcare delivery models. This is very important because so far we are only focused on electronic health record, medical record of the patients. We don't know what is happening with the patients at their home. We don't know how much his blood sugar or blood pressure at the home. We only measure blood pressure of the patients only one time in a month when he or she visits the hospital, right? Therefore, we need to have some continuous sensor. Then what we are doing now is we are adding all these things into here, data analytics. At the same time, we are providing some information directly back to the patients, like I told, patient engagement and patient empowerment from the data we use from the sensor. Because this patient engagement and empowerment is very crucial for patient to participate in their healthcare management. Unless until they do that, they cannot really make very well advantage of the healthcare systems. So definitely the patient need to be what you say participate, engage in their own healthcare management. So these sensors or devices provide a very good tool for patient to engage and empower. Once we get data from this is purely from hospital, this is purely from home. Once we combine, we get very rich data to make our clinical decisions and improve the patient care. That's how it works. Now I will move towards adherence and technology, how we make them to do what we need. Number one, before technology, I will talk about the pills, medication. You see, this is only in America, US, 637 billion loss of revenue because of medication non-adherence. I am 100% sure the situation is even bad in developing countries like India and Indonesia. What happens is patient takes medications, go home, take it for 1 day, 2 day, maximum 3 days, then they throw rest of the medications. Everyone will agree with that because that is how human beings are made. If we don't need or we don't have pain, we just don't use or remember. But how much money we are wasting. Imagine if this non-adherence is with antibiotics and it happens very common. When we go for doctor for some infection, he or she prescribes antibiotic and you take for 6 days or 7 days, you go home, take for 2 days, you feel better, there is no pain, there is no fever, and you forget. Then what happens? This will give rise to antibiotic resistance. Next time when you have this problem, the doctor need to give second line of infection antibiotics, higher in antibiotics. If you continue to do this, you will develop superbug. You need to know what are the problems of the superbug. That means you cannot be treated by any antibiotic anymore because all your bacteria got resistance to the antibiotic medications. You see how severe is that. Therefore, there is no universal solution to improve adherence. However, growing evidence suggests that combining approaches that are tailored to address a patient-specific adherence barrier or challenge may equip patients with understanding the tools they need. That is exactly what we want to focus on wearable device. So it's not just if a patient is non-adherent, but the question is why? Why the patient is non-adherent? Therefore, there are various factors. If you see the slide, it's like socioeconomic factors, therapy-related factors, patient factor, condition-related factors, health system factors. So I give like simple example. Economic factors means if I want patient to use wearable device like Apple Watch, how many patients can buy Apple Watch? Of course, not every can buy. That comes like economic factors. Therefore, we need to come up with the solution which are accessible by which patient can buy it and use it. If they don't buy, we need to see arrangements whether we can give them with subsidies or by government whatsoever. So that is one problem. Second is like therapy related factors. So, for example, if the patient is under chemotherapy, it gets a lot of nausea, vomiting, headache, pain. So there are so many symptoms. So we need to see whether when the patient has this type of severe symptoms, whether we can really ask them to do this or not. Then come health system factors. What is that? Whether the system has the what to say protocol of collecting data from the patient, from the device to the mobile phone to the server, and a arrangement has been made whether the nurse or the care provider can see the data which we are collecting. Right? If we don't do that, then there is no point how much the patient is using. If the patient is not getting feedback, very soon he or she will just forget about using the device. Then there is something called persuasive technology and adherence. Persuasive technology means as an interactive computing system designed to change patients' attitudes and or behavior. Attitudes toward their healthcare and behavior towards their lifestyle. How? By using technology. And again, all these five systems can help us how we can change the lifestyle of the patients so that they can start adherence, they can start using the this thing, devices, technologies in order to improve themselves. Then I give some examples of data-driven adherence support and artificial intelligence. So this is, if you see top figure, there is nothing IT, it's routine. Patient goes to see doctor and prescribe medication. Then the patient take medications and then sometimes he adheres or not. But when we use this personalization, the adherence improves. Why? Because we are promoting e-filling and we advise seeking via phone, decision support through electronic devices, information acquisition through various sensors and technologies. And you see, we are providing monitoring. So adherence to medicines, personalization of medicines management and monitoring leads to better adherence and improved health status. That is what research has found. Therefore, we give routine treatment, then we cannot expect so much change from the patient. But whereas if you start using technology, if you start collecting data from the patients, physiological and when they are at home, then you are empowering and monitoring and engaging the patient. Here is one example from Qatar. Of course, I hope you guys know Qatar is near Dubai, UAE, but Qatar itself is a small country. There, one of my friends were conducting a study where they were using what you say mobile apps to empower the childhood obesity, meaning they selected children below 15 years, but they need to be obese. Then they provide with a wearable device to collect their physical activity. Then they were providing this type of messages. Okay, if you eat burger, this much fats you get, this much this thing you get, how good it is, how bad it is. See, you should eat low carb, you should eat more vegetables, you should eat proteins. In that way, they were educating. But they found only girls were more listening or adherence to this type of solution compared to boys. So you know the context, you know the lifestyle of the people. Therefore, it's making sense. Like girls, Qatar girls embrace technology to tackle obesity more than the boys. Then another very important lesson what we learned from the project was you cannot just take a good solution from one country and implement in another country. It will not work. We need to monitor according to the local context, local lifestyle, local mindset, local behavior of the population. So they conducted a predicting sleep quality using physical activity from UK, from the London, and they used back in the Qatar. It doesn't work at all. Therefore, what they learned was they need to monitor all the solutions at that point, not from one point to another, one country to another. We cannot do that. This was the same study which they were using physical activity for predicting the quality of sleep quality. Because usually physical activity is very much closely related with the sleep. If you do more exercise in the day, you can sleep better because you get tired and your body want to relax and you get good sleep. But if you are sitting all the day, you are only watching movie or sitting in sofa, then you are not so much tired, right? Therefore your sleep quality may not be as good as when you do some physical exercise in the daytime. Yeah, this is all about adherence of using sleep quality for the breast cancer patients. So what I do now is I give like 5 minutes of interval, and if you have any questions, I will take it right now. Then hereafter, I will give an examples of the projects what we have done in Taipei Medical University. Is that okay? So first, if you have any questions, I will take right now. If you don't have any questions, then we have 5 minutes of interval right now.
So, is it any question from the audience?
Yes.
You can
You can type or you can write, whatever.
or hands up, it's okay. And you can directly ask the question.
But I will be back in 5 minutes.
Oh, okay. Untuk para mahasiswa bisa juga menanyakan dalam bahasa Indonesia, mungkin nanti akan kami bantu untuk translate ke bahasa Inggris. Udah juga. Yang dari YouTube ada yang bertanya, bisa juga nanti dibantu akan dibantu untuk bertanya lewat Zoom. Jadi mumpung ini ada pakarnya bagi mahasiswa, terutama mungkin mahasiswa S3 ataupun mahasiswa S2 juga yang kemarin merencanakan akan menyusun aplikasi ya, pendekatan-pendekatan menggunakan aplikasi ataupun menggunakan pendekatan artificial intelligence juga mungkin bisa ditanyakan ya, challenge-nya, kemudian potensinya seperti apa. Mumpung kita hadirkan pakarnya ya, yang sudah berpengalaman mengembangkan pendekatan-pendekatan menggunakan artificial intelligence. Oh ya, Bu Hernina ya. Bu ya.
Baik, selamat pagi Bu Dina. Perkenalkan nama saya Hernina Dinada Pangestika dari peminatan AKK. Mohon izin bertanya. Okay, for Dr. Shabbir Abdul, as we know that right now we are in the paperless, we are trying to paperless by using a technology, for example, using AI or Internet of Things. But from my question is, do you think in this field, I mean health field, it is necessary to still use paper, especially for EHR or electronic health record for avoid AI error in system? Because yeah, as we know, there's a lot of error in system. So I think we are still necessary to use paper for avoid that or that error. So what your opinion for that? Thank you.
Yes. So actually, I have answered this in coming slides because yes, solutions are there, but the question is whether we are prepared to use those things, whether we have our healthcare systems ready to accept this type of technologies, this type of models. So you need to listen complete my lecture in order to get the answer what you are asking me. Okay, good. Is there any other question?
Yes, there is a second question from Susmika Savitri. How is the security and privacy of patient information maintained in telemedicine consultation for patient with mental disorder?
Very good. Yes. So again, technology is available. So we don't need to worry about security, safety, because these type of technologies are systems, healthcare systems are used in Europe and US. So of course, we means from developing countries, we are no more curious or scared or worried about privacy and security compared to Europeans and US. So there are all standards in place, there are all securities in place which will not breach any information from the patient to outside. So technologies are already available. We can use all those things. So no need to worry on those things.
Okay. And the third question from Wahidin. What is the advantage and not advantage if we are use the AI OT? I think it's very dangerous maybe, or can you give a suggest about that?
No, I need to understand why dangerous, in what way? That is the question, no? Okay. So, because we are not giving medicines, or it is not giving like something which make you worse. So it give only advice, which is common advice. So the watch will not say you something which makes you like a dangerous situation. So actually, I did a heartbeat, detect fetal. Is this can be? So I don't know whether this is same question or different question. If AI can detect fetal heartbeat, yes, that is exactly the reason why we need to have wearable device and telemonitoring. When we have what you are talking is fetal heartbeat is okay. Fetal heartbeat is for pregnant ladies. For that, we need to have a device which is connected to their womb or belly, and it can detect fetal habitus. It is. And replacing, no, we don't want to replace. I never told in my talk that we should replace AI or robots with a human. No, always AI system will complement, give support, you provide help to the doctors or the persons. So we are not replacing anything. Any more question?
Okay. Maybe from me, Prof,
Yes.
because among medical students, they also has question related ChatGPT
Yes.
and how's the ethics to use the ChatGPT and in healthcare or in medicine or in maybe in research.
Perfect. Good. Although this is off topic, but still I would answer this because actually I am making a MOOC on do's and don'ts using ChatGPT.
Um,
Because right now people are misunderstanding or misusing ChatGPT. First of all, you need to understand what is GPT, like generative AI models. We call it like massive learning language models, right? The purpose of ChatGPT is not to make a question search like a Google. Google is a search engine. ChatGPT is not search engine. You cannot go and ask which is the best treatment for this medication, this disease. No, ChatGPT is not for that. ChatGPT is to generate things. If you want to generate a report, if you want to generate a essay, if you want to generate to know some point what is happening and how it is to be done, there you use ChatGPT. So where you can use, okay, you write something and you want improvement on that. Yes, you can put this to the chat GPT and say, please improve the quality of my English in this paragraph. Then the chat GPT does the good job. Then you have some, want to write your, what you say, motivation letter, for example. Then you need to know what are the qualities of the job. You need to know what are the qualities you have. Then you put both things and ask ChatGPT, please generate a motivation letter for doing this. Then it does a perfect job. So you just need to know how to use it. So in your case, medical students cannot use to learn the concept. Yes, they can learn. Okay, if I don't know what is, say, some disease, pheochromocytosis. This is many of you don't know what it is. It's adrenal cancer in the renal. So you write, explain me this. Then it gives a knowledge of what it is. You can use it for that, but never use as a treatment tool because ChatGPT is not for giving you decisions, giving you treatment options. And I see more questions. Can you read that,
yes.
Tina?
The from Sudiarto, how AI can work to person who need physiological support while he or she is so depressed. So maybe do you have any example related AI that can help for physiological support for the
Psychological. Yes. There are so many tools already available because this is exactly where we can use again ChatGPT. This question because there you need someone to respond to the user. In this case, patient with the depression. Then he goes say, I am depressed. Then we can make a system where the system has to answer to the patient's issues. then we can use. There are so many tools. You can just go and Google. There are chatbots.
Okay.
We call it chatbots. I think I have shown this in my slides as well. Next.
So the next question is about how do we utilize technology such as AI for health needs, and how do we protect ourselves if something goes wrong?
Wonderful. For this, as I told, first thing is problem. You need to know what you want to solve. You cannot, this is not correct question. Why? Because you are asking how I can make my healthcare better using AI. No. Why you want to use AI? What problem you are dealing with in healthcare? So first, you specify the problem. Then automatically you will know whether that can be solved using AI or not. So therefore, you need to be very precise.
Okay. And the next is to create a good model using AI approach such as deep learning, we need a very large data set. The data set, I mean, is not only patient medical data, but it is image and video data from US and X-ray for computer-aided diagnosis to assess radiology to help diagnose cancer malignancy, for example. How much
Very
data
good.
should we need to get a good model? Okay.
Very good question. But again, at the end, you end up with diagnosis of cancer malignancy. That means your problem is cancer malignancies. So for all cancer, you don't need X-rays, right? If you are talking about blood cancer, why you want to take X-rays, CT scan? If you are talking about brain cancer, then you need brain CTs or MRIs. So
Yes.
everything depends upon what problem you are solving. Again, you cannot diagnose all cancer using one AI model. No. For each disease, we have different systems, different diagnostic tools, and different models. Correct? Yes. So as I give my example, lung cancer. For lung cancer, I need chest X-ray, I need MRI, maybe or CT scan of the thorax, and maybe blood values. Then, of course, clinical information. So that is the requirement. Number two, how much data should be needed? It depends upon your question, what you are diagnosing. Again, go back to my lung cancer. For lung cancer, all these things, what I told, will be necessary, but how much depend upon your model. So I use, say, 100 patients, but my accuracy and AOROC is only 70. Is that good enough? No. Then I need to get more data. The more data you get, the high accuracy and AOROC you will get. So there are other so many issues like biased, unbiased, whether it is generalizable or not generalizable. So again, we don't need to go into depth of those things because that also again belongs to AI in medicine topic, not wearable device.
Okay.
Okay.
Okay. The next question, I think it's still similar. It's related AI replace the need for human to work at healthcare or something like that?
So I already answered like no AI will replace, but it will give support. Yes, if we have a model where we are perfect, we are 100% sure it's doing good job, then we can try to help it in developing countries where there is no human at all. That's opposite, not like AI replacing human. When there is no human at all, at that time we can attempt to try using AI so that we get some sort of help to the people. So, example, in Africa, in many cities, there are no radiologists.
And in your project in China, next to China, it's about telemedicine.
Mongolia.
Teledermatology. I think I still remember that there isn't any dermatologist in each.
Exactly. Yes. That is like an example. True.
Okay.
Okay.
So
So
continue.
I will continue with my examples. Then at the end, I will give again chance to the people who really want to ask something more. But now my presentation will be just describing the projects which we have done. So the basic content I have been delivered. Now I am giving some examples. So I will be very fast and superficial. But if you guys have any questions, you can ask. Okay. This is one first of my European project at Tepe Medical University, what you are seeing. As you see, there are a lot of other universities from Spain, Greece, Italy, and what you say, TMU is only from outside Europe, where we want to develop this app for people who wants to quit smoking. Because I am sure in Indonesia also there is a lot of problem with the smoking. Although there are like three group of people who are smoking. Number one, who don't want to quit smoking. Whatever you do, they will not listen. They don't quit. So better not to touch that. Number two, people who have some health problems, like undergone surgery, undergone some big problem. Doctor told you should quit, otherwise you will die. They will quit automatically. So again, we don't need to worry for the people who landed up with some serious problem and they need to quit. But there are a large third group of population who are willing to quit, but they don't have enough motivation to quit. There comes this project. This project motivates people to abstain from smoking, meaning going away from the smoking. And we made this app. This is in, of course, in Chinese. And this gives you how many days you didn't smoke, how many cigarettes you didn't smoke. For example, if I was smoker, I don't stop. In this last 8 days, I would have smoked 49 cigars. And this much money I have spent only on my cigars. And this much of health I have lost, or I would have lost, if I were smoking all these days. Understand? But how this works? When the people download the app, we get lot of questionnaires from there. 60 questions about their health, about their age, gender, with whom they live, they have kids or not, they have pets or not, they have elderly or not. Then we try to use those information when we are sending messages back to them. And we don't send so many messages in a day. One message, two message maximum. And then we will ask them to rate the message so that we send that type of message. And then we send only positive messages. We never say you will get disease, you will get cancer, you will land up this problem. No, they already know, and nobody wants to read bad things about yourself. Therefore, we always focused on positive things. So in this case, 8 days you are not smoking. Then we send a message. See, 8 days you are not smoking. Your taste buds are improving now. In next few days, you will taste the real taste of the food. Because if you are smoking, taste buds get destroyed. You don't feel the real taste. One thing. If you are female, then we send okay, see, already 8 days you are not smoking. Your skin is starting to get shiny, so you will become more beautiful if you don't smoke. Continue to not smoke. Same thing with hair fall. And also we can use like this. If you have baby, we say, see, your baby is not only you, your baby is also getting healthy because since last 8 days, she didn't get second hand exposure to the smoking. So these are the things which we use for developing this model, and it really worked. And there were different type of messages like awareness, motivation, action, behavior, so that we see what type of things the users like, and we used to send similar messages. And we used AI to select the message. And as I told, we tailored that. As I told, if you have elderly, then we say, okay, not only you, your grandfather is also not getting exposure to the secondhand smoking. So please continue not to smoke. And we see the abstinence rate increased from 18 to 41 by using this app in within 6 months. So which was very good, and you see, we managed to publish in good journal this thing. Here is chatbot for patient support. This is about, the doctor was asking one of the student about chatbot for AI for people with their depression. Yes, you can go. I really feel bad, exhausted, I am sad, blah blah blah. Then it gives you the messages. So there are different type of chatbots. One only type and give the text. Other one talk, give the audio sort of thing. Then all these things I talked with you guys. Here comes the important thing. Behavioral monitoring using wearable device. What purposes are there? There are medical device, there are consumable device, psychometric assessment. One of the user was asking whether we can use for psychological assessment wearable device. Yes, facial sentiment and all those things are there. And the important thing is, uh, by using digital device, we can make use of maximum information from the patient. Patients are most underused resource of information in observational studies, right? But why? Because we observe them only when they are a hospital. Once they are at home, we don't see them. Therefore, we need to have wearable device, and that should be used in observational studies. So these are like advantages of consumable devices and what you say, medical devices, advantages, disadvantages. I have shared these slides with you, so you can refer to these slides, and it's not so much this thing. And we managed to do some studies. Again, these are open studies. You can go and refer where we use wearable device for the cancer patient 7 days, for 7 days, and see how the device are changing according to the cancers, meaning sleep behavior changes according to the type of cancer. So we used breast cancer and prostate cancer, which are totally different. For breast cancer, these are young women, and prostate cancer are elderly or men. So the sleep quality will be totally different, but we want to evaluate using wearable device. And then we use these hemodialysis patients with non-contact sensors, where we use predict clinical events for the people. Again, you guys can go and see all this information from this thing, paper. This is another interesting sensor wearable device where it will be used on your chest. It collects ECG, body temperature, body movement, physical activities, transforms to your smartphone. from phone, it goes to the server. Then these are the specifications, and this is how the data looks from the device. And if you zoom in, you can even see the chest movement. And if you see here, this is the time the patient is sleeping, and this is he got up, and this is he's doing more physically active. All those things we can see by seeing the raw data, but we do detailed analytics. We can even see how many times the patient is coughing, how many times the patient is breathing, all those my information. And these were the various applications of biopatch used in psychiatry, cardiology, sleep analysis, preventive medicines, and all those things. And I want to end up with my current project, which we are running right now. It's about personalized health monitoring and decision support based on AI and a holistic health record. So again, there are like 14 different universities from Bulgaria, Sweden, Spain, UK, Romania, Greece, and only Taiwan is outside of the Europe. And this is how it works. We collect all information provided from heterogeneous sources and try to give some suggestions to the patient. And contribution of TMU is we are doing two different things. Number one, by seeing the electronic health records, not sensors, only electronic health records, that is what you say, medications and diagnosis, we can predict the cancer of lung cancer, liver cancer and pancreatic cancer. Once we know this group of people are high risk, then we provide wearable device and we try to motivate them to do more physical exercise and close observation for two aims, with two aims. One, to prolong the onset of the disease, because we are saying these are the people at high risk, so we don't know when they will develop. Therefore, we want to prolong the onset. And the second thing is early detection of these cancers. Then this is the digital trial which we were doing with these patients, and this is the device which we are using. It shows your count, your calories, your sleep, and here again it shows your circulation index, fatigue index, all those things. That is what we are doing. Coming to the question. So someone is talking, please can you mute?
Halo Pak Isbandi, tolong di-mute. Tolong di-mute microphone.
Okay, good. Thank you. Here comes the question somebody was asking me, whether we are ready. That is the question you need to answer, not I. So we are changing our model of healthcare. Point of care expanded to home care via technology. So are we ready for new doctor-patient relationship? Are our medical healthcare records are ready to provide this type of services? This is exactly what was asked to me, but that is exactly what we need to focus, because this answer will be different in different countries. So I cannot answer what is happening in Taiwan and you can take it for granted in Indonesia. So you need to focus what is happening in Indonesia, how things are working, whether this type of new technologies will help you to proper monitor and patient engagement or not. And real world data algorithm, whether we can trust the data which we collect, is there any data bias, and how we design the studies and all those things. And at the same time, we should not forget about adherence support. That's very important. So the conclusion is the following. Technology-driven possibilities are rapidly growing and increasingly becoming available. The question is not which technology to be used, but what are the needs. So please give important on the needs of the clinicians and the patients, not on the technology or solutions. Then take home message, focus on the needs, problems, not on technology. Consider technology as a tool, not as a solution, because solution can be anything which solve your problem, right? So focus on preventive and early detection of the conditions, and technology should be used to empower and engage the patient. So thank you so much. This is what I want to present for you guys. So once again, I will be happy to take questions.
Okay, thank you so much, Professor Shabbir Sheikh Abdul. I hope all the students enjoy this amazing presentation. And now we will continue with answer some questions.
Yes.
Any?
Can I stop my screen?
Oh, yes.
Okay, so that we can see the.
Oh, yes. All of the students. Okay.
Yeah, it's good if everyone opens so that we can see.
Yeah.
And I think you can take the screenshot also.
Oh, yes.
The,
Yes. Yes. So we can wait the question and take a picture together.
yes.
So all of the student, I hope you can turn on your camera since I will take a picture. First, okay. Second page, there is
11 pages there. Wow.
yes.
Wow. Good, good.
We are so curious related the artificial intelligence in healthcare. That's why since we face or maybe using AI, but how to use AI in
I think if you want, we can have another talk on this topic.
yeah.
Yeah, we can ask our Dr. Alam
Yeah.
to see. At the same time, I'm serious. I will be like more happy to be there rather only doing online because COVID has gone, so we
Oh
can.
yes. I hope we can invite Professor Shabbir to Semarang. Yeah. Since
Yeah, think about that. Yeah, definitely.
oh, okay. So Mr. Lukman, is it any question from YouTube? Is it any question from the audience? Oh, okay.
Yeah, there is one, I suppose.
Okay, Asaida, I have question. Despite from the economy sector that make people can occupy the change of using healthcare system, like you say before, Indonesia is one of the developing country that have an old idea about technology. So they become more trusting human diagnosis than technology. How we as medical human resources can convincing people, especially patient, for using any medical technology.
Okay, for this, what I want to answer is after COVID, things have been changed. I totally agree with you before COVID, but now people have understand the power of technology. They know how to use technology, so it has become much easier. But again, it's up to us how we are convincing, how we are providing evidence for the people who are not very much friendly with the technology.
Okay, and maybe question from me.
Yeah.
Related implementation of AI OT, is it any guideline or maybe any association that can give standardization related how we implemented AI OT in healthcare?
Actually, we as a researcher, healthcare providers don't need to worry. Who need to worry are the biomedical engineers or the vendors who are developing this type of technology. Unless until if you want to develop a device where you want to embed your AI in the sensor, that is totally engineering part,
Wow.
right? Yes, there are standards. Yes, there are FDA approval needed before we use for the patient.
Mhm.
So that should be our worry. What are the devices available right now, which are certified, which are using standards that can be used so that we can evaluate that type of devices,
Okay.
right?
Yes.
Mhm.
Okay. So maybe related some of student worry about how about the data security since in our country many times we heard about data leak from the government institution itself. That's why we are worried that if we implement.
No. I totally understand and totally agree with the concern. I am not saying we should not be worried. What I am saying is already there is enough technology available to provide safety and security of the data which we are online.
Mm.
Understand? So we
Yeah.
don't need to worry about there is nothing available online. No, there is. The only thing is you need to update your system and you need to use advanced technology available for safety and security of the data which is online.
Okay. Okay. Thank you so much, Prof. Shabbir. Is it any next question from the students? Okay. Okay. I think we can conclude the meeting if there isn't any question. And I hope in the next time we can meet directly Professor Shabbir in Semarang with yes, with the interesting topic, still the related with AI and also
AI in healthcare is already a good topic. I think I have a lecture for that. So let's see.
yes. Okay. So this conclude the meeting. Thank you all for attending.
Thank you guys. Thank you so much. Thank you so much.
We hope you
Prof, my pleasure.
enjoy this presentation.
Shukran, shukran.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam
warahmatullahi
warahmatullahi wabarakatuh.
wabarakatuh.
Thank you, Prof.
Thank you.
Thank
Thank you,
you,
Prof.
Mr. Professor.
Thank you, thank you, thank you. Thank you.
Yes.
I will share the link for the I will share the link for the wait for the e-certificates. So for all the students, give attention about the e-certificate issuance. This is the link that you need to write your email correctly, since the e-certificate will be sent to your email address and the link is active for only 60 minutes after this guest lecture over. Okay, so maybe now you can take a note for the link or maybe trying to access before I close the meeting. Oh yeah. Okay. Okay, so all of the students already write or click the link. Or maybe each coordinator of the course can copy the link and share to your friends. I will conclude this meeting. Okay, Mr. Lukman, maybe I will leave this meeting. Thank you for all. Ya, terima kasih untuk semua mahasiswa yang sudah bersedia hadir dalam topik kali ini. Insya Allah pekan depan kita akan ada lagi visiting lecturer terkait dengan penulisan jurnal internasional. Nanti pengumumannya silakan ditunggu. Ya, sama-sama Pak Wahidin. Jam 2:30 saya tutup ya, insya Allah.